5, 4, 3, 2.
Good afternoon, my friends. The doctor is in the house. Happy Wednesday, everybody. Welcome back to another episode of To Your Health with Dr. G. My name is Dr. Mark Gomez. I'm a board-certified internal medicine physician practicing out of Edward Hospital in Bolingbrook, Illinois. Welcome back and happy Wednesday. I'm so excited for today's show because really we're all about continuing this theme that I started a few weeks ago. And it's really about this back to school health series. And today I'm excited to be talking about fall sports and injury prevention. Again, my name is Dr. Mark Gomez. You can check me out on my website, www.drmarkgomez.com. Check me out on Twitter, Instagram, and Facebook. My handle is @toyourhealth.G. So again, on this great Wednesday, we're continuing health. And that's really the purpose of the show. This purpose of the show is really about building trust and delivering truth. And I want you out there that's listening to really leverage me. Look at me, leverage my connections. We really want to make sure that people have the right information because there's a lot of blatant falsehoods out there and mistruths when it comes to healthcare. And health is kind of complicated, there's no doubt about it. But I want people to leverage the networks that you have in front of you. If you don't have that network, I want you to find that network. So again, I'm excited today to talk about the next series of health, and again, back to school health, which is important. And a couple weeks ago when I launched this series, we talked about really the importance of us as caregivers. For me, as a father, as a parent, my wife and I doing the things that we can do to help our kids succeed in all aspects of life, and health is important. And when you know you have success with health, you will have success in your life. So, without further ado, I want to just welcome you guys again. Welcome back to all the previous listeners and welcome to the new people out there. We're excited to talk about health again today, but let me hit you with a quick disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. And again, I want to give a big shout out to our sponsors today, Zynex Medical Incorporated and Health on Earth Wellness Center LLC. So each week, I gather a group of my expert colleagues and we talk about a different topic. So today, again, we're talking about fall sports and injury prevention. And I want to hit you guys with a couple stats out there because this is an important topic because it's going to affect a lot of us that are caregivers. So here we go, straight from the CDC. You know I'm all about stats, guys. So 30 million teenagers and children will participate in some form of organized sport. And when we think about fall sports and injury prevention, high school athletes account for 2 million injuries per year, 500,000 doctor visits per year, 30,000 hospitalizations per year. So again, and in that population of children aged 5 to 14, they account for nearly 40% of all sports-related injuries treated in hospitals. So we're going to talk about some of those stats on a little bit more in my panel today, but I want to hit home the point that we can prevent injuries. That's our goal today. But we can also talk about enjoying the sports and things that we're doing. A lot of kids are being active. We got a group of panelists on today that have children that are engaged in activities. So we're going to tell it right from you from the experts as parents to make sure people out there have the right tools for success for their kids. So I want to welcome to the show my panel today, my first guest, Dr. Gregory Dairyko. I've known Dr. Dairyko for a long time. He and I go back to our days in med school together, even though I went to Loyola, he was at Northwestern. It's all good. But we were at different medical schools, but we connected a long time ago. We were both in medical school, started in the year 2000. And we connected as medical students just through the network of Chicago and being a young black medical student, connected with other individuals that are out there. And we've been friends and colleagues ever since. He sees a lot of my orthopedic patients in my regular private practice. And so I'm excited to welcome him to the show. Dr. Greg Dairyko is a board-certified orthopedic surgeon with DuPage Medical Group. Check him out, www.dupagemedicalgroup.com. Dr. Dairyko, welcome to the show.
Thanks for having me. I really appreciate the invite.
Hey, I'm excited to have you here, man. This is so important because you're a sports guy, I'm a sports guy. Our next guest, Larry Love, he's a sports guy. So this is important, and again, as a parent, this topic hits home with you. So why don't you just tell us a little bit about where you did your training, medical school, residency, sports-related training. Go ahead and Give us your story.
Sure. So I grew up on the south side of Chicago. I then went to the University of Michigan for undergrad. I have to tell everybody I did go to Whitney Young for high school as well.
All
so,
right.
So pure Chicago.
Local.
Right. After finishing up in Ann Arbor, I went to Northwestern where we met for the first time, came back home. I then did my residency training at the University of Chicago, and then did fellowship training. So I'm a board certified orthopedic surgeon, but I took an extra year to do specialized training in sports and sports related injuries. And I was lucky enough to go to Cincinnati to do that for a year. And then I came back and joined M&M Orthopedics, which was acquired by DMG in 2013, and here I am.
Excellent. Thank you, and welcome to the show. My next guest today, he and I go back a long time, and I kind of giggle a little bit because Larry Love and well, Larry's been on the show before a number of times, and when I think about today's theme of fall sports and injury prevention, when I was crafting the show, I kind of said, man, I got to have a guy that's out there who's in the thick of things and helping people train properly, prevent injury, and certainly rehabilitate. So I want to welcome my good friend, Mr. Larry Love. Larry is the owner of Total Body Wellness and Performance Incorporated. Larry, welcome to the show.
Thanks for having me back, Dr. G.
Hey, you bet. Larry, why don't you give us a little bit about your background? What's your story?
Well, real quick, Dr. G. I did my undergrad at Illinois State University. It's an undergrad in athletic training and sports medicine, and also gained my master's in health and wellness psychology from the University of the Rockies. And that's been a great combination for dealing with the mental side and also the physical side. And we just take a huge prevention to performance approach, whether it's a kid, whether it's an athlete, or whether it's just an everyday person looking to, gain more recreation in their life and optimize their lifestyle.
Excellent. Well, thank you, gentlemen, for coming on the show. We're going to get into some nitty-gritty in a bit. But again, I'm just excited to have this kind of discussion. Again, this goal of the show is to really get people the tools out there, the parents that are out there with kids in school, kids playing sports, trying to enjoy sports, just the information that we can have for you. And then whatever kind of questions you guys have, I encourage you to write things down and talk with your physicians about them, talk with your healthcare practitioners, talk with your chiropractor, talk with your physician, talk with whoever you entrust with your healthcare about this kind of a topic, because again, we always believe that prevention is the key to everything when it comes to healthcare. So each week when I have my panel here, I always talk about what's called the chief complaint. So I want to reintroduce that concept to any new listeners that are out there, and certainly to remind old listeners about this concept. So each week we have a chief complaint, and the chief complaint in healthcare is when somebody comes into your office with that specific reason. And so I've kind of modified the chief complaint a little bit, fellas. And really, so the question of the hour, the chief complaint we're talking about today, is that now that fall sports are in full swing, how do we best prepare our children to avoid injury while simultaneously maximizing their ability to perform at the highest levels? So I want to start out with Dr. Dairyko, give him the first question. Why don't you describe like a typical day as an orthopedic surgeon, and how this theme of fall sports and injury prevention really relates to what you do on a day-to-day basis?
Sure. A typical day, there's two typical days. One is when I go into the office and see patients that have had injuries, and I usually start my office at 8 a.m. on a Monday morning, and anybody that's injured over the weekend, they're the first folks that come in and see us, and we always try to get them in, especially our high school athletes in the areas that I treat, and we take care of them. And in terms of going in and asking what happened, they kind of recreate their injury. We usually get some x-rays, do a full physical exam, and figure out what's going on and try to get them feeling better. The other part of the day is surgery, and as an orthopedic surgeon, I'm able to diagnose injuries and also treat them surgically as well. And that was one of the main reasons why I wanted to go into orthopedics, because I really wanted to take care of the whole person on the clinical side and surgical side. And that's something that I feel strongly about and have a great time doing. And it's nothing better than getting an athlete back to their pre-level injury, pre-level function prior to their injury. And that just makes me feel so great when I can see a guy run around and say, "Doc, thanks so much for getting me back." And that's what I do.
Excellent. Larry Love, why don't you tell us about how this theme relates to you on a day-to-day basis?
It really resonates because I also have a two-part day. The first part of the day is normally clinical, where there's some type of evaluation where I've been referred a client or a patient by such as Dr. G and Dr. D here. And so in the clinic, we're looking for any type of evaluation of motor skill dysfunction, correcting any musculoskeletal injuries, but also optimizing movement. And a lot of times, particularly with youth athletes, movement patterns that are dysfunctional are really what create a lot of the injuries. And so the second part of the day is actually on the field. So what we're looking to do is really injury management. If anyone gets hurt, how do we manage that injury and maybe make the appropriate referral to the correct physician? But also, what's their return to play? If they can return to play, that's an important delineation to make then and there. So it's kind of a two-part day. It's exciting. One day is more assessment. The other part of the day is actual on the field where you're doing sports medicine coverage to just make sure the athlete can safely return to play, and that's real important.
Excellent. I know for me, one of the things as a primary care physician, and kind of like Dr. Dairyko, the phone rings Monday morning to your office, and you're trying to triage, basically your staff is trying to triage people to get them in. And so certainly injuries, as you've heard a million times, a lot of those weekend warriors, but kids are active on the weekend, a lot of sports and everything, so the injuries happen. So no doubt that the phone rings. I know from mine as a primary care doctor, I'm trying to make sure we get some things assessed, a proper exam, and then get them over to you as soon as possible. So I want to ask you this question. What's the challenges when you delay treating a potential injury?
Oh, sure. Delaying the injury or treatment to the injury really sets back the patient in terms of their rehab and getting better. It's so critical to come in, and I always tell my patients it's a lot easier to say, hey, don't worry about it, everything's okay, than, oh my gosh, what happened for the last 3 months and you came in to see me. I try to get the patients in as soon as possible when their injuries are relatively new in order to get them back as soon as possible.
Excellent. Well, so it's interesting. So Larry Love, from his perspective, Larry's an athletic trainer, is a certified strength and conditioning coach. And I know one of the things you always talk about is prevention. And so when I think about like prevention, we relate to health and sports, we break it down into three things: primary, secondary, and tertiary. And so it's interesting from a primary care perspective. I think we always think about primary being preventing something, avoiding injury. Secondary is more like secondary prevention involves the early diagnosis and treatment once injuries occurred, and then certainly that tertiary aspect of prevention is really related to the rehab itself and correcting any existing disability to get them back, as Dr. Dairyko says, back to their pre-existing level of function. But so Larry, let me ask you this question. Is there a best way to prevent injury from where you're coming from?
There's a two-part answer to that, but I kind of want to follow up on what Dr. Dairyko was stating.
Please go ahead.
Delaying, addressing injuries, and I'm going to take it from the psychological approach, because many times if someone has a lingering injury that they haven't really dealt with, that plays havoc on them. I mean, there's 5 phases that they go through. You go through depression, you can go through anger, rationalization, until you finally accept the fact that, hey, you know what? I got something wrong with me. I need to have something done about this. So from a psychological perspective, delaying injury is not just physical, it's mental as well. Now, getting back to your question, is there like a best way, to prevent an injury? Really knowing that, you have one. That's the best way right there. And also getting the appropriate help, and not just the help, appropriate diagnosis from a qualified physician, not only a physician, but maybe one that specializes in a particular field. So to speak with Dr. Dairyko, an orthopod, that's very key to address, musculoskeletal injuries. And I'm not saying that, no doctor is qualified, but getting the appropriate care, that's real key, because now that doctor can then refer you to the right individual who can now carry out the journey of the rehab process or prevention to performance process.
I think as adults it's different, because I'm mainly a lot in the adult world, and probably the youngest patients that I have might be about 16 years old, so you guys may have seen certainly a little bit of a younger group. It's easier for adults to kind of voice their injuries. It's probably a little more harder in kids, especially if they're younger. They might not necessarily be as comfortable with their body. They might not be able to obviously tell you those exact kind of words that you're looking for, some of these red flags. How do you get around that, Dr. Dairyko? There may be some parents out there listening today thinking something might be wrong with their kid, but they don't know if the kid's even telling the truth or anything like that. Or even when it comes to like adolescence, you know, to admit that you got an injury if you're on the field, you know, that's kind of a sign of weakness.
Sure. I definitely look for cues. When the patient comes and sees me, you know, I look for cues. You know, when I go through my physical exam and ask them what happened, I take into account that, you know, kids might not be able to voice their concerns. So a lot of patience is required, and really trying to be a detective, trying to really figure out what's going on. If the patient feels, or the patient's mother or father feels that it's that important to come see me, then I have to figure out what's going on. And even if they say, you know, doc, I'm fine, or this or that, you know, you really have to take it a step further and be as thorough as possible. Other things are facial cues. When I'm doing my physical exam, I'm always looking at the patient's face. They may not say anything, but they may start jumping off the table, literally.
That's right. You try to do like a provoking move.
Oh yeah, and the family is always like, well, they didn't say anything. I was like, but did you see him almost jump off the table? And they're like, yes, we did. And so little cues like that, and just trying to be as thorough as possible, knowing that there's probably something going on. Another thing is that if the patient isn't doing, you know, their level of function in their sport, or they're missing their targets in throwing a baseball, or they're not hitting their gymnastics flips or routines, and something's wrong, or they're asking for, you know, ibuprofen in the middle of the night, and some odd things just not right. Usually it's time to come see someone like myself, or, you know, a physician, to see just exactly what's going on.
Thank you. Larry Love, what's your take on that one? From an athletic training
From an athletic training perspective, I really feel that kids kind of sometimes have this confusion about what's pain, what's soreness, what's hurting, what's an injury. And having a team is real important. And when I say a team, a medical team. And so that's why it's important for youth organizations to have certified athletic trainers on site. So if there is an injury that occurs, they can go to the athletic trainer, and then he or she can refer further to have that dealt with. Or at the same time, you know, as I'm out there, or any of my staff are out there, we're looking, you can see when a kid is just not moving right. They may, you know, be slumped over a little bit, or they may be lethargic. But I think it's real key to have clear and open, concise communication with the parents, so they know they can come to you and say, hey, you know what, Johnny's not quite right today, but we also need to be able to go to the parent and say, listen, Johnny shouldn't be participating today. This is who he or she needs to go see. It's their job is to also be compliant and follow up on that. And so that's a real big key. The follow up after you say, hey, you're noticing something's going on. Let's follow up on this and go from there.
And so we're going to talk a little bit about the high school kind of scenarios and that are going on at the coach level after this brief message. I want to thank again to my silver level sponsor, Zynex Medical. Zynex Medical's Next Wave is a prescription strength electrotherapy device that helps patients manage their pain symptoms and increase muscle functionality without the side effects of opioids. If your practice wants to make pain control a drug-free habit and is interested in learning how to prescribe, contact your local Zynex representative, Lori Wilk, at area code 331-454-6482. And again, Zynex Medical, www.zynex.com. So let's talk a little bit about what we're talking about, because the reality is you know, kids nowadays are pushed to perform, and there's no doubt that the level of commitment at the high school level almost has the mindset of the commitment at a collegiate or pro level. And so the reality is a lot of times we're seeing more and more injuries because of the rush to get back to play. But let's take a step back forward. I'm going to ask this question to Larry Love. What's kind of the importance of, like, can you explain what is a functional movement screen, or things that are like these pre-assessments before you get into the season that teams, coaches should be doing at this point?
Yeah, that's a great question, Dr. G. So when we take any movement assessment or a screen, what we're looking for is simply what the show is about. We want to see, is there any injuries that are potentially present? Is there any movement patterns that are dysfunctional? Is there any asymmetry of strength? And so when we talk about an athlete or any person that participates in movement, we want to see that their mobility is even on both sides. We want to see that they have balance. We also want to see that their strength is congruent on both sides. A lot of times you'll have a kid who's an excellent athlete that progresses to a teen, but what happens once they get into high school, they're like, man, this person is plateaued out. That's because some assessment has been overlooked as some potential muscle imbalance, and that will catch up with you. And that's why it's so important to have something as simple as a screen. A lot of parents will say, my kid's fine, but once you get into the screening process, it really will show you if there's some dysfunction. And if dysfunction can be corrected at the earliest stages, now you can have injury prevention, and now you can have optimal progression to optimal performance.
So, Dr. Dairyko, what's your thoughts on this one? Where it's like, you may have again pressures from maybe at the coaching level, or maybe just some inherent pressures that the kid might have themselves, knowing that they may be injured, and then they want to get back right away. Maybe they say, "Oh, I'm fine." Sometimes, let's be honest. Sometimes people don't tell the truth. Let's be honest. People don't tell the truth in life sometimes, and they go back. They rush to get back, and then maybe they do okay, but maybe they don't do okay.
Yeah, it's a tough situation. Being a team physician for a local high school and seeing a lot of patients that are in season, I always have that conversation up front with the patient and the parent at the initial visit. I say, hey, this is probably a 4-week injury, but I want you to come back and see me in 2 weeks, and we'll see how you feel. However, there may be a chance you're not better, and if you're not better, all you're going to be doing is injuring yourself further if you go back too soon, because we're going to have to start this whole thing over again. And when you start that clock over, now instead of 2 weeks or 3 weeks, you're out 6, 7 weeks. And high school seasons are about 9 or 10 weeks apiece. So you're basically taking yourself out of the whole season by rushing back too quickly.
Yeah, and again, I think it's it's interesting. I don't necessarily get asked that kind of question as a primary care physician, because usually those questions I defer to you guys because you guys are the experts on that one. But every now and then I'll get somebody that say, Doc, can you clear my kid to do things? And I'm like, hey, your kid had an injury. I can read the report from you, Dr. Dairyko, or whatever, and they might come back and see me. And I'm like, well, you really should talk to the specialist. You should talk to Dr. Dairyko, talk to one of his colleagues to get the clearance out there. But sometimes I get that feeling. It's like, and the coach wants you back. The parent wants him back because maybe they got somebody looking at them, the scouts coming in. They're a high school junior. It's just tough. It's a tough situation to be in because you don't want to protect somebody from themselves. What's your thoughts, Larry, on that?
Well, a couple things. You do have parents that will kind of rush the process, and I always go back to the mental part of things. You do have a lot of parents who are vicariously living through their kids, and that rush to return to play can sometimes not be most appropriate. The other thing that I think we want to look at too is we have a lot of kids that are specializing so soon in sport, okay? And that specialization is hurting them more than it's helping them. Back in the day, it used to be real vogue to have a 3-sport athlete, but what was great about that, it gave your body different movement opportunities, different movement patterns. It prevented you from having just such an overuse and performing a certain movement day in and day out. So your body developed, to its totality. Now you have kids that, and we'll just take baseball for instance, if you're throwing a baseball all year, of course you're going to have elbow and shoulder issues as you progress. Football is the same way. You can do as much weight training as you want, but at some point, that's why we have an in-season, an off-season, a postseason, and a preseason. And when people follow those delineations and those rules, then they're probably going to get a really good product. A lot of times, more is not necessarily better. And from that approach, that's where the qualified professionals come into play. That's the team approach. You need a great doc. You need a great athletic trainer. You need a great performance coach. You also need a great recovery specialist too, because that's what's going to allow, tissues to heal, reduce a lot of inflammation that occurs with overuse and just from participating in sport.
And we're seeing a lot of stuff, obviously we're in football season, big time, and girls soccer is going on. There's just a lot of things going on at so many levels. And there's so many steps that are out there that people can take to really protect themselves. Dr. Dairyko, what are some just kind of general guidelines you might advise your patients? Just say, hey, I just want to not get injured, or what are some simple steps that people can do to listen to their bodies and hopefully to try to avoid injury?
Oh, sure. I think even in the high school kind of age range, I think it's very critical to stretch, before you start doing explosive movements. I see a lot of musculoskeletal injuries, of course, and other things is to ramp up activities. So stretching is one, and ramping up activities specifically in cross country. The fall season of cross country starts, and I typically see 10 kids that come in and say, oh, I started having shin splints. And I said, well, what'd you do this summer? Oh, nothing. And how many miles are you running now? 40 to 50 a week. And so it would hurt anybody, you know. And
I'm hurting right now.
Right. And unfortunately, I also have a difficult conversation with some people and saying that specifically cross country is that you may not be able to run 40 to 50 miles a week. Like, that's not what God intended, you know.
Right.
And so, unfortunately, some folks have to switch sports. But just listening to your body and ramping up your activities and stretching and doing proper form. In terms of football, tackling appropriately, doing things in the safe manner is critical in order to prolong your career.
So, we talked a little bit earlier about this kind of pre-season screening, making sure you review a good history and physical. I know that's one of the important things that we try to do from a primary care perspective, to make sure there may not have been something that may have been overlooked. But what about the importance of screening people, like a season analysis? Like, you're in the middle of the season, how important is it to just kind of refresh, the kids? Maybe they didn't have any injuries, or maybe you have picked up something, Dr. Dairyko, this question's for you. But how important is it to just continue to have a continual analysis, maybe periodically through the season?
Oh, I think it's very critical. I work with the athletic trainers at the school I take care of, and athletic trainers around in general, and they're really the lifeline for our patients. They see me maybe once or twice, but they have almost daily interaction with athletic trainers. I think that it's critical to have a great athletic trainer on staff, and they're going to be our eyes and ears. They're going to say, like you were saying before, if someone's just not looking right or not doing something right, and they can pick that up and then alert us so we can kind of intervene before anything happens, serious.
Excellent. Well, I want to ask this question to to Larry Love. Not a doctor yet, but it's all. But you have a ton of knowledge. So, I mean, when we talk, we have this very high level discussion as if you were a clinician of that level, because you're around it so often.
Sure.
So you kind of learn a lot by just doing it. But I want to ask you this question. Is there, so go back to this idea again, people are compelled to play. And so what happens if you play through pain?
Yeah, that happens more often than not. And playing through pain presents a couple issues. For one, you can further the injury. For two, you're going to expedite the inflammatory process. And three, you're going to prevent the length of healing, okay? When you continue to play through an injury that needs to be addressed by sitting out or addressed through rehabilitation or addressed through modalities of icing and different things like that, you're just prolonging a potential, not prolonging, you're actually instigating a potential injury that's going to happen at a greater degree. When that happens, you're going to be out even longer. Sometimes it may be even catastrophic to the point that it may be season ending. So as an athletic trainer, we're real key on really putting injuries in perspective. There's things that, like I said, there's a difference between being hurt and injured. And with those two delineations, we never want anyone to go out on the practice field, the playing field, the court, or into competition where they have an injury that's going to get worse by continuing to participate.
Yeah, the stats, you can't lie against the stats. I mean, the stats tell us that since the year 2000, there's been a five-fold increase in the number of injuries specifically related to serious shoulder and elbow injuries, and we see that in the baseball and softball players. And a lot of that could be related to, as you're saying, the specialization at a young age of athletics. How do we kind of avoid, obviously there's so many factors that are driving that, whether it's the drive for success, or parents live vicariously through their kids, or for a lot of different reasons. How do we are there solutions out there to try to have your kid be a little more broader in their scope? Because at the same time, I know some of these coaches will be like, well, we're not even going to give your kid the light of day. We're not even going to look at your kid unless he or she's done this, and that. Otherwise, they're not even going to make the team. How do we kind of get around that, knowing that there's so many injuries out there? Dr. Dairyko.
Yeah, it's a tough situation. And we've seen in our orthopedic community or the literature that there's been an explosion of ACL tears and things like that. And unfortunately, like you were saying before, the best thing you can do for a child is to have free play. And where's free play? You know, there's a lot of different factors that have been involved that, and that's decreased a lot. And the over specialization of sports at a young age, we see that all the time. I see elbow injuries, shoulder injuries, like we were saying before, and it's just to let the parents know that, you know, if you're, like you're saying, throwing the ball every single day for 7-8 months, something's going to happen. And so you have to have some type of diversity in the sports that you play or the movements that you do. And even if it's just, you know, training boxing or something in the off season, something different than what you're doing, you know, something that could have a different movement pattern. It's so critical. And I'm sure if you let the parent, if you have a decent conversation with the parents and tell them that they're at increased risk, you know, Johnny might get his, you know, elbow, you know, injured significantly if we don't change things up. I think that's so critical. And it's just having a frank conversation with the parents, I think, is very critical.
I know when I was a kid playing up, growing up, I was playing. My folks got me involved in a lot of different things. We played soccer, we did baseball, football, basketball. Growing up here in the Midwest, you know, I thought that when you have that kind of diversity, as you mentioned, Dr. Dairyko, that made things a lot more. It made it fun.
Yes.
And I'm worried about kids now as they keep going through this specialization that it takes the fun out of it. We want kids to be kids. I did a show a couple weeks ago. We talked about the importance of play. You just mentioned the word free play. It's gone to the wayside, and hopefully there's ways to bring that back, because there's a developmental aspect of that. There's so many other beneficial things that happen when you allow for that free play. But it's, you know, at the same time, we're up against something that is much more challenging than we think, but hopefully as caregivers we're not trying to fall into some of those peer pressures. Larry Love, what's your thoughts on just this idea of, like, we need to get more free play back into our kids when it comes to helping them out with life and sports?
I'm definitely an advocate for it, and to piggyback on what Dr. Dairyko and you were saying earlier, it's so key that we're in this age of informatics and analytics. And we do that with, okay, you know what, this person, you know, shoots this percentage behind 15 feet on a basketball court. This person runs a 4+ or sub 440 or whatever, if that's possible. But the thing is we put informatics and analytics into performance, but that whole informatics and analytics, parents don't always listen to when it comes to injuries. And I think it's really key that we go ahead and have these serious conversations with parents. So instead of a parents' meeting being how we can raise money for, you know, a fundraiser, it needs to be, okay, these are the things that your kid should and should not be doing if they want to, you know, progress. 2 key words that gets a parent's attention: can't play. And when you tell a parent that and say, hey, your kid is at risk for not being able to play, not just today, but in the future, that really gets their attention. You know, moving forward, I really believe that free play, it still reminds me of when we were kids, when we just went out and we went to the park and climbed on the monkey bars and went down the slides, or you were riding your bike for no reason. We're in that age of Xbox and PlayStation. And so the sedentary opportunities for kids, their mind is working, it's stimulated on a game, but their bodies are not working and moving. So I blame the parents a little bit. You know, nothing's wrong with PlayStation and Xbox. Limit that time that they do that. Encourage them to get up and go outside. Encourage them to be in family-oriented activities. Sometimes if the family gets involved, that'll spark the kid to maybe try something a little new or different, because they go to school and they have in their mind that, okay, after school, I'm gonna get on PlayStation, Xbox, and then I gotta go off to practice. And it becomes very mundane for them. So sometimes it takes the family to be a little bit more creative, getting some family activities going, you know, getting some diversity to spark the kids' interest in a different way to advocate, you know, free play.
We were talking about a lot of the challenges of the modern day student athlete. It's different than what we did. Let me ask you guys a question. Dr. Dairyko, did you play sports growing up?
I did.
What'd you play?
I played a little bit of everything. In high school, I was a baseball player, I swam, and I played football.
All right. And Larry Love?
I played everything as well, but After my junior year, I specialized in just basketball.
Okay.
And so I could not remember a season where I was not busy with a different sport. And that's what made it fun, because today's society is different from our society. Back in the day, you had athletes that could play any sport. Now you have specialized sports participants trying to become athletic. And that's going to be the dividing line of why a kid doesn't make a D1 school, because they're not as athletic anymore. They've specialized too early. And so they've lost that opportunity to have athletic performance, and they become exposed. Yep.
This segment is brought to you by our silver level sponsor, Health on Earth Wellness Center LLC. The chiropractic care offered at Health on Earth Wellness Center LLC in Crestwood emphasizes the importance of improving your health in an effort to reduce the risk of pain and illness. As a patient at Health on Earth Wellness Center LLC, we will personally tailor a chiropractic and wellness program specifically targeted to your needs using the least invasive yet highly effective techniques and services. For more information, visit us at www.healthonearth.live. Thank you to them for helping us out today. So I want to ask this question. How does nutrition, where do you see, like Dr. Dairyko, this question for you, where do you see nutrition come into play? Because that's something obviously that's not really talked about much at the high school level. It should be, but the difference between like a kid who's 6'10" who could dunk a basketball, and somebody who can't is obviously the difference that they can dunk a basketball. But it doesn't necessarily mean that an athlete has the best kind of other kind of lifestyles. We think about the athlete themselves, or oh my gosh, LeBron James who's on another level of nutrition and wellness. But you can dunk a basketball and eat McDonald's every day, and you're still gonna make the team. But let's talk about nutrition a little bit. What's your kind of general approach to kids and adolescents when it comes to nutrition?
Sure, I think nutrition is critical. I typically see it in the first game of the year in football, where kids cramp up like crazy. Like, it's like clockwork. Every single time I've been taking care of Montini High School for the last 8 years, every single first game of the year, at least 1 or 2 kids are cramping from both teams. And then the trainer asks, what'd you eat today? Oh, Cheetos. I had some some Mountain Dew, and so it's so critical to have a well balanced diet, get great hydration, and that'll decrease your risk of getting those injuries. It'll decrease a lot of different things, and so nutrition is very important.
And I think from a primary care physician standpoint, I mean, I have the same concepts that I tell my adolescents that I tell my adults. A couple things. Number one, get sleep. The modern student-day athlete likes to stay awake a lot, and maybe it's because of getting the Xbox and the PlayStation, but you got to rest. Eat some square meals. Eat some vegetables in that diet. I know it's not the most important thing that kids want to do is eat some vegetables, but your nutrition is so centerpiece here. Protein, limiting your carbohydrate intake, drinking a ton of water. Not a lot of water, because you should drink when you're thirsty, but don't overdo it, because if you drink too much water, there is a condition known as hyponatremia, which can be a dangerous condition if you're really doing it. But we want to say we need more guidance in that kind of point on things. Larry Love, what do you kind of tell some of the clients that come into your office about nutrition, especially some of the kids that are out there?
Well, particularly, I work with a lot of youth organizations, and for instance, the Downers Grove Panthers, and a lot of kids, like Dr. Dairyko said, you say, hey, what'd you eat today? Mum's the word, right? And part of that, though, they don't know what to eat. And so providing those informatics to their parents of, okay, what's a pregame meal? Maybe what's a postgame recovery meal? What's something they can have that's, if they've been in school all day and they only have had lunch and now they're about to go to practice, what should they eat? And you're right, there does need to be enough hydration, not overhydration, but I also think, people, carbs get a bad word, but no, carbs are not bad. Carbs that are not burned are bad. And so if you're an athlete, you need some carbohydrates in you to sustain, a particular, task over a period of time. And also, if the kids or athletes don't have any allergies, I mean, there's a lot of simple fixes. I mean, a simple peanut butter and honey sandwich, takes you a long way. But also, what I really see in particular with kids, they don't need a lot, but they need something. And part of the problem is they're just not getting anything. And so when you can provide different, pregame meals for the parents, I think that helps them out a lot.
Excellent. And it comes down to education as well, too.
Absolutely.
What are some things that schools can be doing right now to kind of promote healthy eating, not just for I mean, obviously we're talking today about student athletes, but just for kids as a whole. What are some things that schools can be doing for their athletes to support them from a nutrition standpoint? Larry?
Well, first of all, you have to provide the things that you want the kids to eat. The vending machines, I don't know if you've seen a vending machine in a high school lately, they've really changed their tune. It used to be pop and candy. Now there's more, heart healthy snacks in there. There's also more protein oriented snacks, less of the sugars, less of the pops. I'm not a proponent for or against Gatorade. I think it has its place, but at the same time, the amount of sugar that these athletes or kids in general are intaking, if they don't have total access to all that sugar, that's going to help them. Also in a cafeteria, back in the day, it used to be pizza and fries, right? Now, they're offering salads. They're offering, lean cuts of meat. So we have to be able to provide these kids with the right nutrients if we expect them to ingest the right nutrients.
Dr. Dairyko, do you see things from, because you've been experienced with a lot of work with the high school level, is there any incorporation now of nutrition into just general programs, football, basketball, things like that? Are you seeing it, or do we need to just do a better job at doing that?
Well, I think we need to do a better job. I see it at school I take care of. They provide fruit at halftime for the kids, some waters, some peanut butter and jelly sandwiches, just to get them hydrated and give them some energy for the second half, and that's critical too. But overall, I think what Larry was saying is so critical and so important, and I think if they do that, then it'll go a step towards fighting this problem.
So I want to ask this question, and I'll ask this question back to you, Dr. Dairyko. A lot of times we talk about the difference. We're talking about what can we do today to help our kids prevent injury, and then hopefully at the same time while maximizing their athletic performance. And we know that fatigue contributes a lot to injury. A kid might be running on the football field, or somebody's swimming in the pool, and they know that they get fatigued, and then their form may change, and then injury happens. What are some things that we're doing now to kind of educate the kids this way, or just to try to prevent injury from just lack of form or tiring out, and maybe you get tackled wrong because you're tired, and then now the injury happens. So what are we doing right now to combat kind of fatigue, or how are we training? Are we training differently for these kids, or are we preparing them differently?
Well, I think a lot of it goes into recognizing that you're tired and letting the coach know.
Okay.
Speaking up. Another thing is a lot of core training. Core training is very important in all different sports, and if you strengthen the core, you do have a chance to kind of push through and successfully complete a game, or a week of practice or something like that.
Larry Lowe, are you seeing the same kind of thing as well too? Actually, technique, form getting compromised when you're fatigued, and then now that leading to injury.
Exactly, but like Dr. Dairyko stated, core strengthening is key, and so that's going to be one of the first breakdowns you notice in an athlete. Either they're moving differently, they're absorbing a hit differently, their explosion is a little bit different. So their whole optimal opportunities, you really see them degrade. But the other thing too is, anytime we have an athlete that may have a breakdown, it's really important that everybody's eyes are on the athletes. It's not just the athletic trainer, it's not just the attending physician. The coach should be watching too. That's why he or she has assistant coaches. Now we get the parents, because you know how parents are. When it's their kid and something, they're like, my kid, check them out, right? They're going to pay attention, right? And so I always say this, and I at all the meetings at the beginning of the year, I say, listen, it takes a team approach to really help these athletes be the best they can be. I think the other thing too is educating everyone and them understanding that practice doesn't have to be 5 days a week. You can have a 4 day a week of practice, have 1 day of recovery, 1 day of just nothing. So I think as we evolve and understanding that more is not necessarily better, but the intensity that you get out of the kid while you have them, that's what's important.
Dr. Dairyko, let me ask you this question. We live in the age of certainly tech, we're seeing a lot, and sort of from a medical standpoint, we're seeing a lot more tech use and everything. We get these 3 Tesla MRIs. We've got this, portable ultrasound, obviously, that's got even better resolution. How are you using tech now? How are you using like medical tech imaging devices now in the diagnosis of sports-related injuries?
I typically use MRIs for a lot of injuries in terms of the shoulder and knee. Ultrasound has definitely come into play, and it's a very good modality. The only thing about ultrasound is that you have to have someone that knows how to do it very well performing it, and it's kind of user limited. But if you have someone that performs it all the time, then I think it's a great idea. It's a non-invasive thing, and it's a little bit quicker than an MRI, and it gives you almost the same information. And those things are very important too.
Yeah, I see. I feel like a colleague of mine. He's the team doctor for USA Rugby, and I've looked at some of the things that he's done on social media, and he does ultrasound right away, so you can get that access to somebody right away. But it goes back to what you were saying earlier, that it's so important to get that diagnosis right away, so you can have a right treatment plan. Correct?
No, without a doubt.
Excellent. Larry Love, are you seeing anything from your end, from a new techniques from an athletic training perspective in helping people prevent from getting injury?
Yeah, so there's simple modalities that, like a foam roller, for myofascial release, and now there's these Theraguns that are out that, really, pop across the muscle, which is really key for healing a lot of injuries. The other thing that we're seeing, and it's not techie or anything, but it's just simply, Fitbits, different things like that. How many calories have you expended today? What's your, how many calories have you intaken? What's your expenditures? And I'm an old school guy, but 2 things that never hurt: ice and heat. Those still work, right? They're not.
You
not
are
techie.
old school.
I am.
Tech and ice and heat.
I am, but it's not techie. But there are some advancements. I mean, upon our Practice Act, I mean, there's only so much that we can do. But yeah, so that's my take.
Excellent.
On it. Yeah.
Well, what I want to do, I want to go into a section that I call myths versus facts, and this is something that I brought on the show a few months ago, and I try to do it every time I have a show if it's related to that. But it's a time for us to kind of dispel some myths out there, because I swear, as a primary care physician, I'm spending half my day breaking down myths, dispelling myths. So I've got this myths versus facts injury prevention style. And what I'm going to do is I'm going to ask both of you guys, and I'll just pick on you one at a time. I'm going to state a statement, and then you're either going to say myth or fact, and then maybe give us a 1 or 2 sentence reason why. So here we go. Drum roll, please. All right, Dr. Dairyko, here you go. Myth versus fact, injury prevention style. All right. Here's a statement. Being strong will prevent injury.
Myth.
All right, do you care to explain a little bit more?
Well, it's kind of a vague thing.
Yeah,
but,
it is vague.
But in terms of being strong, that could be a couple different ways. Quickly, being strong in your upper body but not in your core increases your risk of injury. Being strong, trying to be strong but not being smart, that'll increase your risk of injury too.
Excellent, thank you. Here you go. Larry Love, myth versus facts. It's okay to play through pain.
Myth.
All right, please tell us a little bit more. Give us another 1 or 2 sentences on that one.
Myth plus. Playing through pain is never okay if you have not been properly assessed. Once you've been properly assessed to know the degree of what's going on, then your return to play is contingent upon that.
Okay. Next one, here's for Dr. Dairyko. I specifically have this question for you, this myth versus fact. And these are things, by the way, that people will tell me, and I've kind of compiled different ideas on myths versus facts and try to help give people the right information. So here we go. This is sort of a medical question, but here we go. Glucosamine rebuilds damaged knee cartilage. Is that a myth or a fact, or what do we know?
It's actually a myth. We had a big study back in 2009 when I first started in orthopedics that says the glucosamine chondroitin it doesn't hurt people, but it doesn't necessarily help them more than a placebo or a sugar pill or something like that.
Excellent. I agree with you 100%. I try to block that much, but I tell people, hey, even to some of my adolescents, say, hey, if you want to, really adolescents shouldn't be dealing with something loss of cartilage at that point, that young age. But I think about my adult population and say, hey, you can give it a try, but there's not really a lot of evidence behind it. Here we go. Larry Love, myth versus fact. Here we go. A person should work out every day.
Fact. And the fact is working out is not about the same intensity, it's about diversity. So some days you can have low intensity, some days you can have high intensity. Some days it could be resistance, some days it could be just stretching, some days it could just be balance. So having a diversity of movement patterns and kind of how you treat your body will do it good.
I'm a big believer, just get the body moving. I try to tell my patients and my adolescents, just get 5,000 steps in. That's just kind of my own Dr. G approach, but
Absolutely.
Keep the body moving and make it personal and how you want to do it. Myth versus fact. Here you go, Dr. Dairyko. Running is bad for the knees and other joints.
You're getting all the good ones.
I was specifically picking on Dr. Dairyko.
Right. I'm gonna say myth. If you don't, with a caveat, if you don't have a knee problem, if you don't have a hip problem, if you don't have a low back problem, it's fine. But if you do have those problems, it's probably not something you want to pick up.
Excellent. All right, next one. Here you go, Larry Love. Here's a statement. My child has a high tolerance for pain.
According to who? I'm gonna say that myth. Okay, for the simple fact that tolerance of pain is very subjective, but that still has no bearing on if a kid is returning to play. If they have any pain threshold or not, will it prevent further injury? And so I'm going to say that's a myth.
Okay, here's go. Next myth versus fact. Dr. Dairyko, we got a couple more. Here we go. It's okay to pop painkillers. These are things that people tell me.
Right. So again, myth, depending on what they're popping, it's okay to take some anti-inflammatory medication, provided they don't have any high blood pressure or something along those lines.
Yeah, I say, you got a gastric history, gastric ulcers,
Exactly.
don't be taking that, and if you have
Right.
renal insufficiency.
Right. There's a lot of
don't do
things.
that.
Right. So there's a lot of things. So I would say, you probably shouldn't do those things.
Okay, here we go. Larry Love, here you go. Myth versus facts. Orthotic inserts work wonders.
Well, I'm going to go middle of the road on that.
Okay.
So if they're store-bought orthotics, they probably won't work wonders. If they're custom orthotics, they have a better chance of working.
Okay, thank you. And that's the last myth versus fact to Dr. Dairyko. Here we go. And we might have already covered it, but we'll just say it again. Here's a statement. I can never drink too much water.
Oh, well, we already know that. From listening to you, Dr. G, we know that's not right.
Yeah, that's it. You can get yourself to a dangerous condition known as hyponatremia, and that can really throw your electrolytes out of balance. It can lead to a whole bunch of other complications as well, too. So I tell people, when you're thirsty, drink. You don't have to force it. When you're thirsty, you drink. Your body's telling you, I need to drink something. All right, so we got about 5 minutes left. So what I want to do is I want to wrap things up. And so this has been just great discussion with you guys. I'm so glad that we were able to connect on today's topic of fall injury and sports, fall sports and injury prevention. But I want to wrap this up. So we talked about at the beginning the chief complaint on why people are the question of the hour that we've been dealing with. How do we prevent injury while maximizing function? But the assessment and plan, that's how we kind of do things in the medical standpoint. And so the assessment and plan is when people come in and we just kind of give them their diagnosis and kind of their treatment strategy. So I'm going to start with Larry Love. Let's wrap this up. Give me like 3 key take-home points for consumers out there, people that are listening to the show, consumers of healthcare, to be successful when it comes to best preparing their kids to avoid injury and have fun with their sports.
That's a great question, Dr. G. So we're going to take it from 3 different perspectives. The first one is correction. If there's anything that needs to be corrected from a strength deficit, movement deficit, we want to address that. Second one, we want to go protection. Protection is where the real injury prevention takes place. We'll just use the rotator cuff as an example. Simply do an internal, external rotation with a soup can or something like that. And then the third one is progression. Progression to optimal performance.
Excellent.
And that's it in a nutshell.
Dr. Dairyko, give us a couple of take-home points for parents out there, caregivers, to make sure that their kids are successful with their sports, but also preventing injury.
Well, I think that, again, you have to set a goal for your child as to what they want to do and what they want to accomplish. They have to do great form. They have to listen to their coaches. And they have to also tell their parents if they are having something going on. And it's like we've touched on before, it's so critical, it's so important to see somebody if something's not right.
Excellent. My kind of take-home points are as follows. Children need special attention and care when participating in sports. We know that injury prevention is a safety and a public health goal. And when you have success in that aspect, it leads to better chances of being successful in life and having a sustained quality of life. So I want to thank my guests today, Dr. Greg Dairyko, board certified orthopedic surgeon, DuPage Medical Group, www.dupagemedicalgroup.com. Check him out. I've known him for a long time. He's an excellent orthopedic surgeon. Mr. Larry Love, athletic trainer, certified strength and conditioning coach, owner of Total Body Wellness and Performance Incorporated. Check him out, www.totalbodywellness.net. I want to thank my silver level sponsors, Zynex Medical and Health on Earth Wellness LLC. Next week on the show, we're going to be concluding my back to school health series. We're going to be talking about part 3, dental and oral health care. You guys know me, Dr. G. Check me out on my website, www.drmarkgomez.com. My handles on social media @ToYourHealth, Dr. G. Peace out.